As we begin to return to in-person learning, parents and guardians are some of the most important partners in keeping students and teachers safe and healthy. The first line of defense in keeping students and staff safe and preventing the spread of coronavirus is performing a wellness check every morning before leaving your house. First, take your child's temperature. If it's higher than 100.4 degrees, they should stay home. If their temperature is normal, ask if they are experiencing any of these symptoms, even if you haven't noticed any: a new cough, shortness of breath, difficulty breathing, muscle or body aches, unusual headaches, loss of taste or smell, sore throat, new congestion or runny nose, nausea, vomiting, or diarrhea. In the event that your child develops any of these symptoms, a list of local COVID-19 testing sites can be found here. If your child has been in close contact with a known positive COVID-19 case within the past 14 days, they must stay home and quarantine, and you need to notify their school. If your child is staying home because they are experiencing symptoms, you also need to contact your school to notify them of their absence and that the child is experiencing symptoms. To provide Webster Grove School District with information over the weekend, please call 314-918-4693. Students who begin experiencing COVID-19 symptoms while at school will be moved to a health isolation room, and their emergency contacts will be called and given instructions to pick them up immediately and how to do so in a safe manner. Please ensure that your information is current at school, including emergency contacts and individuals authorized to pick up your child or children from school. If that list includes anyone who is at an increased risk for severe illness from COVID-19, consider identifying an alternate person. Staff who begin experiencing COVID-19 symptoms while at school will also be isolated and sent home immediately. Criteria for sending students home and next steps will be based on low-risk symptoms and high-risk symptoms. If your child has one low-risk symptom, they will be sent home and may return to school 24 hours after symptom resolution without fever-reducing medication. If your child has two low-risk symptoms or one high-risk symptom, they will be sent home and may return to school pending the outcome of an evaluation with a healthcare provider. If the healthcare provider confirms an alternative diagnosis for symptoms, they must provide documentation to that effect, and the student can return to school 24 hours after symptoms have improved and the child has been fever-free without fever-reducing medication. If the healthcare provider refers the student for COVID-19 testing and the result is negative, the student may return to school 24 hours after symptoms have improved and the child has been fever-free without fever-reducing medication. If the COVID-19 test is positive, the student may return to school 10 days after symptoms first appeared and 24 hours fever-free without fever-reducing medication and other symptoms of COVID-19 are improving. If your child has been a close contact of a COVID-19 positive person, they will be sent home and may return to school 14 days from the last contact with that person unless symptoms develop. Should there be a positive COVID-19 case in your child's building, all teachers, staff, and families will be notified. When a student or staff member tests positive for COVID-19, the district will begin contact tracing. Additionally, any students or staff members who have been in close contact with the affected individual will be notified and required to quarantine for 14 days. St. Louis County Department of Public Health will determine, based on information provided by district, which individuals were exposed and will need to quarantine. The health department's decision will be made on a case-by-case basis and could affect anywhere from just a few individuals to an entire class or school building. Make sure your child is up to date with all recommended vaccines, including for flu. All school-aged children should get an influenza flu vaccine every season, with rare exceptions. This is especially important this year because we do not yet know if being sick with COVID-19 at the same time as the flu will result in more severe illness. You may also want to consider talking to your child about some of the precautions that will be taken at school. Your child will be advised to wash and sanitize their hands more often, keep physical distance from others, and wear a mask. Proper mask techniques are important, and we will continue to work with your child to promote adherence to that precaution.